I want to go ahead and take a look at red flag laws. In your words, what are they? Do people understand what they are? And why aren't they being used more often?
Sure. So red flag laws, also known as extreme risk protection orders, work to remove firearms from individuals who are known to be a risk to themselves or others. These laws are different in each state. Different states have different practitioners, including law enforcement, family members, dating partners, mental health practitioners, who can all file an order and state what evidence there is that this individual should not have access to their arms currently. And then that evidence is presented to a judge who makes a determination or a ruling whether or not this individual should continue to have access to their firearms or if they should be removed temporarily for up to a year in most states.
Why do you think there's so much pushback on these laws, on these red flag laws?
There is some pushback, but we've also seen bipartisan support for this. Last summer, when the Bipartisan Safer Communities Act was passed, it had bipartisan support and $750 million in funding for ERPO implementation. And the key here is not just to pass the laws, but to have them implemented, to raise awareness, and to have the champions on the ground who can successfully implement these laws.
So even in states which have these laws in place, they're not really being used. For example, let's talk about Chicago for a second, Illinois, where these laws do exist. There have been more than 8,500 shootings in Chicago alone, 1,800 deaths since 2020. This law, this red flag law, has only been used 4 times. So why aren't they being used more? Are they difficult to use? I mean, you mentioned that there's quite a process here. Essentially, the person has to go before a judge. There has to be a court order. Is this just too difficult to implement?
I don't think it's too difficult to implement. I think that it's a matter of having the resources for implementation, and hopefully now that we've gotten congressional funding, we can really work on implementation. But it takes time to implement these laws. And I would say that, you know, there could be more uptake in certain communities, but we have seen in other jurisdictions really strong uptake, like in King County, Washington. We've seen this being used. And we know based on research that for every 10 to 20 orders issued, 1 suicide is prevented. So I think we can really focus on what is being done in some places and work in other locations to really improve implementation and to help folks on the ground, law enforcement, family members, better understand these resources and better be able to access them.
I want to circle back to the poll that we were just looking at. 85% of Americans favoring a law requiring background checks on all gun purchases, 75% favoring making 21 the minimum age in order to buy a gun, and then 59% of Americans favoring a ban on assault-style rifles. What is the answer when it comes to gun reform in America? And why aren't any of these laws getting passed?
So we would advocate for a public health approach, like you mentioned, universal background checks, limiting assault rifles and high-capacity magazines. It's akin to what was done with deaths, motor vehicle crashes. It's layering interventions, so having seatbelts and speed limits and car seats. It's the same with preventing gun violence, and knowing that a lot of these interventions, like you say, are really supported by the public. And so letting lawmakers know your support for these interventions and background checks is really key to having lawmakers pass these interventions and remove firearms from individuals that we know could be a risk to themselves or others, and making firearms less prevalent in some of these situations.
Now, we know that gun violence is the leading cause of death in Americans under the age of 19 right now. It is overtaken car accidents as a leading cause of death. It seemed as though the CDC was not studying this for some time. We didn't really see a lot of reports come out on gun safety. Why is this? Why was this not made a public health emergency?
That's a great question, and knowing how this is, you know, causing more deaths among children than many other things, I think right now a lot of people are focusing on this as a public health emergency and taking a public health approach to addressing gun violence and thinking about what can we do to not just pass laws but implement laws that are on the books. And more data is being collected by the CDC so that we can better understand this issue that is before us.
Spencer Cantrell is the Director of Federal Affairs for the Johns Hopkins Center for Gun Violence. Spencer, thank you so much for stopping by today. We appreciate it.
Thank you for having me.